CSV as a national charity has always worked with people from marginalised communities, and here at the Ipswich Media Clubhouse we've been working with people living with mental illness for many, many years, and we felt that we had an environment that would offer a more creative outlet for people, and so we sought to find some funding to help create a project around that. The ESF money that we were successful in getting has enabled us to develop a creative, dynamic and alternative project in Ipswich and the surrounding areas of Ipswich around Suffolk. We've been able to develop a creative, holistic timetable of events that focus on social integration, that we support spiritual recovery, we help people with their finances, with accredited training and unaccredited training, and help people with employment opportunities. And more importantly, the most important thing I feel is that we help people, we offer an opportunity for people to have a sense of purpose, a sense of belonging, and a sense of identity in their community, something really for them to get up for in the morning and to know that they are making a difference to themselves and to their community as well. And that's really what I think is central to the running of this project. The ITM funding, well, ITM stands for Innovation, Transnationality and Mainstreaming, has really helped us fill a gap within the area of Suffolk, a real need. At the time of writing the bid and looking for the funding, there were many closures of this type of service in and around Suffolk, and there was a real need for people to have an alternative place to go, alternative intervention from medical intervention, and so we were fortunate enough to get the ITM funding through ESF funding through ITM, and it's enabled us to be really flexible as innovation, the word innovation suggests. It's enabled us to be flexible and open and meet the needs of people on the ground, really work with the participants and volunteers, listen to them, what do they want, how do they want the service to be, and actually be able to change the project to suit. Obviously the project's a 3-year project, and the needs in the first year might change from the 3rd year, so we're able to change through innovation, and that's been thanks to the innovation and ITM strand of this project. So the transnationality side is about going overseas and working with partners across Europe and learning from them and them learning from us, and actually having a two-way partnership about mental health services and volunteer services overseas, and how we can bring that back here, or how we can support them to develop their work as well. And mainstreaming really, again, is about how we can use the work of the SAM project to help influence Suffolk and other services that might come about in Suffolk. And again, at a really crucial time, there's a new tender out at the moment called Integrated Health and Wellbeing, and actually how can the SAM project use its lessons learned to work with other service providers, maybe the council and other people, to integrate what we've learned and how we work, and how we've used our innovation, and to try something different to inform and influence another service. So it's come at a really good time, and we've been very fortunate in what the ITM has been able to offer us, and how open they have been as a service, as a provider as well.